Good day, everyone, and thank you for joining us for our second online Intersections of Gender in Conversation event. I'm Susanne Luhmann. I'm the Director of Intersections of Gender, which is one of 5 signature areas of research and teaching at the University of Alberta here in Edmonton, Canada. And I'm speaking to you today from Treaty 6 territory, the ancestral lands and traditional gathering place for diverse Indigenous peoples in the lands of Métis Nation Region 4. And by acknowledging territory, for me, that also means committing to learning about and understanding the responsibilities of treaties, such as recognizing nation-to-nation relationships. And acknowledging territory also means committing to learning about and respecting Indigenous knowledges and traditions, and engaging in research, teaching, and governance that will hopefully contribute to a wider acknowledgement of ongoing colonial violence. I know that many of you are joining us today from many different places in Canada, North America, Europe, and beyond. And I invite you to reflect upon your own location and the responsibilities that come with living on and with the histories of land and the people who came before us. IG in Conversation is a new series that we started as an opportunity for more informal conversations with researchers about and in response to current events as they are unfolding. We started the series last month when I spoke with Dr. Amy Kaler about gender aspects of COVID-19. And you can find a recording of that conversation on our Facebook page. Just look for Intersections of Gender, and soon on our webpage. And before we begin today, I want to thank Jeremy Chalet of U Alberta International, as well as my colleague Rachel Sukiewski-Pezim. Both of them were central in making this event happening today. So I'm very excited for the opportunity today to chat with Dr. Catherine Clune-Taylor about COVID-19, racism, and masculinity. And the topic, of course, has taken, I think, on another urgency in light of the events of the last few days here in North America. And I'm thinking of the police killing of another Black man, of George Floyd in Minneapolis a couple of days ago, and the ongoing protests that are happening in response to this incident of racist police violence in many US cities today. And maybe less well known, but equally urgent, is the death of Regis Kowinski-Paquette, a 29-year-old Afro-Indigenous woman who, according to her family, was shoved off the balcony by police in Toronto. So I'm really glad that we have Dr. Clune-Taylor with us today to think about racism, gender, masculinity, the COVID-19 pandemic, and the responses to this crisis here in North America. The format of our event today is such that we will spend about 40 minutes talking with each other, and then we will open it up for questions from the audience. You can submit them through the Q&A function on your screen. But let me begin by introducing our guest today. Catherine Clune-Taylor, she, her, hers, is assistant professor in the Department of Women's Studies at San Diego State University in the US, and where she's specializing in feminist science and technology studies. She earned her PhD in philosophy from the University of Alberta in 2016, and she holds BA and MA in philosophy, as well as the BMSc in microbiology and immunology, all from the University of Western Ontario. Her current research explores the ways in which the American system of market health insurance tied to employment maldistributes life chances for Black folks. Prior to joining San Diego State University, Dr. Clune-Taylor was a postdoctoral research associate at Princeton University. And since we have known us for a while, I'm allowed to address her as Cato by the informal name. So welcome, Cato. Thanks so much for joining us.
Yeah, I'm thrilled to be here.
Maybe if you could get us started off by speaking a little bit about how the COVID-19 pandemic, as well as the responses to it as we see them, are shaped by race and gender. How do you see that at this moment?
Yeah, thank you. I say I'm thrilled to be here, and I think, you know, you're quite right that this is a particularly kind of urgent discussion right now. I'd like to, before I kind of answer your question, I want to start by situating myself a little bit. And I thank you for that introduction. I'm going to tell everyone a few more details about me that I think will, in part because they will shape kind of how I'm analyzing what's going on, or how I interpret things. And then, you know, because this is an evolving situation, things are changing each day, I'd like to just look at the numbers and see where we are right now. So just for a little bit more about me, as you said, I have a background in microbiology, and I was someone who actually had planned to go to medical school. I was born and raised in Toronto, and I actually worked in a doctor's office in Toronto during the SARS outbreak in 2003. And as you said, I have this PhD in philosophy, and kind of stumbled down the pathway into feminist science and feminist philosophy of science, bioethics, thinking a lot about the kind of social, political dimensions of science and of healthcare. And as you mentioned, I moved to the US for my position at Princeton in July 2016, so right before the election. And just a few months prior to the election, and it was during my kind of 3 years at Princeton in the beginning of the current administration that I became, you know, I think for a lot of very reasonable reasons, became really interested in thinking about the way that health insurance shapes the life chances of particularly people of color and Black folks in the United States. Given that there was so much debate at that time about health insurance, health care, who should access it, what does it mean for it to be affordable or reasonable, is there a right to it or should there be, but also seeing all of that going on in the context of the movement for Black lives at the same time, right? And recognizing that, you know, for so many reasons that make so much sense, there have been such great research being done and theorizing being done about the way the carceral system shapes Black life in America. And it makes sense. I mean, studies show that 1 out of every 2 Black folks in the US knows someone personally who's been incarcerated or is incarcerated. But everyone stands in relation to health insurance, whether they have good insurance, whether they have bad insurance, whether they have no insurance. And so I became very interested in that. And currently, as you said, I just finished my first year of a tenure track position at San Diego State University, which is about 25 minutes away from the Mexico border. It's also about 25 minutes away from Otay Mesa Detention Center. And that is a location where 57-year-old Carlos Escobar Mejia died of COVID-19 related complications earlier this month. And he was an individual who actually had been living in the United States for 40 years, but was unable to obtain legal status due to criminal convictions from the 1990s, and had been incarcerated in that detention center for quite some time, since January. And unfortunately, he was actually someone who was put on a list to be released because he was considered to be high risk, but was already in hospital with COVID-19 by the time he was added to that list. And I also wanted to note that I am someone who is currently a resident alien in the United States. So I'm here on an H-1B visa, the visas that have been paused. And so I'm in a somewhat funny immigration position right now. And that's kind of the position that I'm speaking from today. Which will, I think, influence, you know, my background as someone who was trained in Canada, I think really kind of influences how I see and read these things. And so I think it's important to kind of highlight that. But just kind of updating us, or I guess grounding us into where we are today with regards to the pandemic. So it is May 29th, 2020. As of today in Canada, there are 88,856 confirmed cases. That was an increase of 994 new cases yesterday. And there have been 6,918 deaths in Canada. There were an additional 112 yesterday. At this point, it seems as though in terms of unemployment data, I couldn't find good May data at this point, but based on March and April, 3 million Canadians have lost their jobs amidst the COVID-19 pandemic. Whereas in the US, we are currently, as of this morning, sitting at 1.7 million, about over 1 million confirmed cases. We had 23,051 new cases diagnosed yesterday, and we're sitting at 101,635 deaths, and that's with an addition of 1,415 yesterday. And so we are in a period where I think states are starting to open, as well as provinces in Canada, or we're moving into this kind of reopening, re-entry period. And we are actually starting to see new hotspots emerge in the US, particularly in states that started reopening early. So West Virginia, Iowa, Kansas, Arkansas, Mississippi, Texas, Georgia, and Florida, as well as Minnesota are showing new hotspots. And importantly, as of today, about 40.8 million, or 1 in 4 Americans, have filed for unemployment. This is likely quite a substantial undercount as well. So it doesn't include the millions of laid off workers who are not eligible for unemployment benefits, those who haven't filed, those who have left the workforce altogether. It also doesn't include the 8 million undocumented workers who have lost their jobs. It doesn't include students who just graduated who are thinking about going onto the job market. But I wanted to highlight this number because, importantly, that also means that 1 in 4 Americans have lost health insurance coverage, right? And I suspect this is the largest single loss of health insurance coverage that has ever occurred in the US, or kind of lack of access to care in a single moment. And after kind of setting that stage, turning to your question itself, I think a lot of observers have noted that the pandemic, as well as responses to it, have been really shaped by race and gender, as well as other axes of identity produced by systems of oppression. So including ability and class, for example. And we can just start by thinking about the beginning of the pandemic and its spread into North America and the kind of virulent anti-Asian racism that this has given rise to. There's been a substantial increase in hate crimes against Asian individuals. There is, I wanted to kind of shout out, there's a really great project called the Asian American and Pacific Islander COVID-19 project that has been very quickly put together by Vivian Shaw and Jason Beckfield at Harvard, that is looking at and studying the way that COVID-19 is shaping various aspects of life for Asian Americans and Pacific Islanders. And they're looking at labor and the economy, community organizing, health and access to healthcare, among other things. But importantly, the group Stop AAPI Hate reported receiving over 1,700 reports of harassment, shunning, and physical assault against Asian American individuals as of May 13th. And we're also simultaneously, seeing anti-Black racism that's emerging in China, that has seen many Black folks living in China be evicted or be barred from different locations, stores, grocery stores, workplaces. And I think what we're also seeing is the way that individuals who are positioned at different kind of intersections of various axes of identity are really bearing the brunt of the pandemic. So I think, in particular, I think a lot about women and women of color who have themselves kind of disparate levels of exposure to the virus. So many women of color work in care giving positions, whether it's working as RNs or LPNs or personal assistants, right? Or kind of folks who are helping to care for others. I mean, we can think of who generally makes up the staff at a nursing home, right? Which are these kind of hotspots that we're seeing emerge in various countries, or long-term care facilities. Women healthcare workers are often on the front line And we have to think of not only the care labor that they're engaging in, that's putting themselves at increased risk of exposure, but then also the stress and the PTSD associated with being in those positions, right? And working extensive hours, often with inadequate PPE. And also we can think about the disparate effects of work closures on women, right? I think a lot of us probably have seen that horrible story circulating recently about the woman who ended up having to basically close her company and let go of her 13 employees because her husband wasn't able to deal with childcare, right? And I know many women are trying to juggle childcare, and we're seeing it across all kinds of class stratas of women who are pulling back from work or just not able to engage in labor. And I think one of my long-term concerns is about how many women will just not re-enter the workforce. I do think, the workforce is probably going to shift in the long run. And so what are we going to see there? Right. But I think the kind of historical trend we have seen in terms of the feminization of poverty means that women, and women of color in particular, are disproportionately affected by job losses and disproportionately vulnerable in this climate, right? This is nothing to say of kind of the increased concerns we have and increased rates of domestic violence that we're seeing. I saw one study that said that, what we're seeing right now is a kind of perfect storm where many women may have lost their jobs. They're now kind of trapped in isolation with their abusers, and perhaps are even now more financially reliant on them than previously. And they're in a context where that kind of frustration and anxiety is mounting, right? And this is, nothing to say of, and I would say I think there's been so many great disability justice scholars and activists who came out right at the beginning of this pandemic to highlight concerns about rationing of care, right, and ableism within the kind of rhetoric that of dealing with this, right, like that, well, it's only high risk people who need to be concerned, right, like this kind of othering of certain parts of the population and positioning this as a kind of increased burden on or risk primarily for folks who are disabled. And again, women are disproportionately disabled, right? And so we have to recognize that is a feminist issue as well, is disability justice. And I think finally, just to kind of touch on issues of class, and I think given the kind of large range of wealth disparity in the US, I think we're seeing this more, and the fact that healthcare and healthcare access is tied to employment. Here, we're seeing more exacerbated problems around class status, but we're seeing them in Canada as well, right? So issues of who is it that has a job that can be done from home, right? Like who is it that can afford to self-isolate and has the privilege to do so, who can afford to not take public transit, right, and who can lower their risks in these ways. In the US, it's been a big issue about who can access tests and who cannot. I had a student who they suspected had COVID-19, and she was able to get a test, but she also was quite upset because she realized the reason why she was able to get a test was that both of her parents were healthcare professionals. Whereas I have other students who were much less privileged, and I had a student who got COVID-19 and then got COVID-19, had a very severe long illness. Her parents subsequently got it, and then she had to care for them. And she was very clear that, with her parents, she had been tested, but then with her parents, they couldn't really afford to go, right? Or to consider that. And so, I think that is a real issue we need to consider here, given the fact that, even moving into this crisis, 40% of Americans could not handle a $400 emergency. And when that goes up to $500, we get to about half of Americans, about 50%. Meanwhile, if you are someone who's uninsured and get COVID-19 and end up hospitalized, right now, the estimates are you're looking at probably about a $75,000 bill, right? And so we need to think about the way that class and issues of class privilege or wealth privilege here are contributing to the spread and contributing to or incentivizing certain kinds of behaviors that we might not want people to engage in for the health of themselves and for the public, right? So I think that's just a little few of the ways I think they're playing out.
I think maybe I will jump to, the topic of this conversation is racism as well as masculinity. And I know that lots of people who are joining us today are particularly interested in the question of masculinity, because I don't think we have had that much conversation about that. So some people have noticed that the kind of the COVID-19 pandemic and responses to it have been informed by masculinity or ideas about what counts as masculine. One example, for example, is wearing a mask seen as emasculating, right? Are women wearing more masks than men? And on the other hand, I think in conversations you have noticed, of course, and we have noticed, is that the countries that have responded most effectively have had women leaders. So, So how do you think about it at the moment? And I know this is kind of preliminary thinking, but what do you think about what are we learning about the role of masculinity and ideals of masculinity in this pandemic? Or how does the response to the pandemic gets kind of shaped by questions and ideals of masculinities? Practices of masculinities.
I mean, I think it's fascinating, right? I have been thinking a lot about masculinity through all this, particularly in relation to the kind of protests we started seeing, and these issues around mask wearing, and the way various kinds of rhetorics about autonomy or freedom, and particularly kind of bodily autonomy, have been activated or operationalized here. And I think a lot about masculinity here is a kind of like a kind of instantiation of patriarchy, right? Like the kind of performative script that according to which patriarchy kind of distributes power and privilege, right? And because I really do think like responses to the pandemic on both the individual and the collective level have been really kind of fascinatingly and horrifyingly revelatory of masculinity, and particularly like white supremacist heterocapitalist masculinity, right? And so I think first I think it makes sense to ground myself in my terminology here. I'm thinking about this with Bell Hooks's definition of patriarchy. And her definition is, quote, "Patriarchy is a political social system that insists that males are inherently dominating, superior to everything and everyone deemed weak, especially females, and endowed with the right to dominate and rule over the weak and to maintain that dominance through various forms of psychological terrorism and violence." Right? So I've been really kind of fascinated by thinking about the way that patriarchy is so shaped around domination and control. In part because I think one of the things that's happening, right, is, and I think all of us are experiencing this kind of increase in anxiety at all of these things that are beyond our control, right? Like we are, this isn't like a clear enemy, right? Like I think in our kind of traditional, which is really kind of interesting actually, because I think we often have these warlike or metaphors in relation, or military kind of metaphors in relation to the immune system, and fighting off infection and stuff like that. When in reality here, what we're dealing with is like an enemy that is minuscule, right? Like it is not even visible to the naked eye.
Yeah.
And it is also like completely indifferent, right? Like there's no intentionality. This virus is just doing what it does, right? And it isn't aware that it's, you know, destroying our way of life or harming all of these people, right? And I think there's something really that in a way to me is part of what's kind of like adding to this frustration, is this isn't a kind of fight that I think has been fantasized about by kind of many folks who were like looking for some sort of big political shift, right? Like I think it's interesting that the first kind of groups of people that we saw who started protesting, for example, in Michigan, are folks who are kind of preppers, right? And in part, I was like, I feel like this is because this isn't the apocalypse you were looking for, right? Like you're waiting for one in which what determines survivability is kind of performative masculinity, right? Is an ability to kind of control and dominate the environment, to protect yourself and your family and yours. And that would have a result in a kind of like political new order, like almost a kind of feudalism, right? Like I'm gonna have my land, I'm gonna protect my land, and I'm gonna do it through performative masculinity, right? But instead what we got is people baking, right? Like it didn't work out in the right way, and it's not providing opportunities for I think this kind of fantasy. Although I will say I think that's only kind of one set of protesters, right? Or like one kind of way that's enacting. But I think if we think about other kind of folks that we're seeing protest, I think it's interesting to see what it is that they're protesting for or calling for, and what's absent there, right? Like we're not seeing people who are protesting to demand that we reopen the economy so that they can keep saving for their kids' college fund, or they can pay their rent, right? Like they want to get their hair cut, they want to get their nails done, they want to go to the beach, they want to golf, right? And what fascinates me about that is those are demands about the performative, those are demands to gain access to the performativity of whiteness, right? That is, you know, how can I kind of maintain this veneer or this illusion of like a certain class level, right? Like I need to be able to kind of performatively engage in my class level and my whiteness in the right kind of way. And importantly, that also requires the ability to exploit certain others, right? Like I can't do my own nails. I have to have my nails done, and I need someone else to do them for me, right? I need my hair done. I need another person to do it, right? And I think it's interesting that the concerns are about a kind of loss of lifestyle in a certain way, and not about life, right? Like in a sense, life is almost secondary. Like I would rather, if I can't live in the right way, I would rather not live at all. But the right way here is really about signaling certain things to others. I also think we are seeing a kind of, or I think we are seeing a kind of like a real frustration being expressed by a lot of folks. And I actually think part of that has to do with the way in which this crisis has made imminent to so many people their own vulnerability, right? I think actually for a lot of folks, what is so angering and upsetting here, and it is about a kind of experiencing a kind of vulnerability that they feel should be or is properly relegated only to others, right? And particularly racialized others.
Right.
And that's a kind of lack of autonomy around one's body, right? Like, you can't tell me what to do with my body. Only certain others can be told what to do with their body. And it's like, not me, not white masculinity anyway, right?
Yeah, I mean, what really helped, what really, when you were talking, what really made sense for me finally is why people are buying ammunition, or men are buying ammunition, but not only men, because it is kind of the fantasy of the enemy that needs to be fended off. It's actually not the enemy that we have, which, as you so well pointed out, is a virus that you can't shoot. But it's a form of, I'm feeling vulnerable, I can't deal with my vulnerable, therefore I'm going out and buying ammunition in order to have this, at least this kind of fantasy enemy. Right? Whilst the virus is not being, you know, you can't protect against the virus. I mean, there's a very, I think you pointed out something very interesting of the response on parts as a kind of white masculine fantasy that responds to something that is a threat, but with completely useless tools.
Yeah.
Whilst the kind of like care, I mean, the kind of amplification of care that is happening, which is historically, and I would say continues as a practice of, you know, feminization, that would actually be the weapon to take on. You know, start sewing masks or build masks. If you can't sew as a, you know, build masks, come up with some kind of invention rather than, you know, if that, you know, if that needs to, you need to shore that up for your masculinity, invent something. But
right. Build a garden, like do something, do a thing. Right. But instead it's a kind of, you know, a kind of demand, you know, like I think it's really fascinating. I keep hearing folks say that, like, what they're demanding is freedom.
Right.
And my immediate response is like, you have to be alive to be free. Like, you can't actually be free if you're dead. Right. And I mean, there are philosophers who can debate this point, but we can. And to me, that's interesting, right? Like, I think one of the things that should be very clear through all of this is that this isn't about life, right? I mean, 100,000 Americans have died. And it's only, you know, and one of the things I saw someone post online today was All Lives Matter only started trending after there became protests against police violence. Like, where were the All Lives Matter when 100,000 people died over the last 3 months, right? And so it is very clearly not about life in itself. It is about very certain lives and how, and I think a certain way of life, right? Like, who, unless you are contributing to this form of life, your life doesn't matter. Right. And the fact that, like, we're seeing protests who are demanding literally for life. Like, we want to live, you know, we want to not worry about being evicted, right? Like there are very serious needs right now. But we see a group of people who feel that the biggest, their primary concern, the way in which their rights are being violated, is through their inability to consume and to engage in certain kinds of, I think, racial and class performativity.
Right. So of course, we're also seeing at the moment that if we don't consume, the economy really goes bust, right? I mean, I think it really lays bare of how much, because the jobs that are gone are the jobs in retail, are the jobs in you know, gym. I mean, the kind of service jobs. I mean, it also shows us really how much I think we're all implicated in this system of consumption. And if we're not consuming, you know, people get become unemployed, and of course it's a racialized and gendered workforce that has been laid off. I think that's the kind of terrifying thought. And I think you have spoken really well to what some people have called a she-cession, and the kind of fears that we don't have a recession, but we have a she-cession, and what the long-term consequences are. And it also kind of, you know, so you spoke to that, lays bare that we are still in 2020 have an unequal division of labor. right?
Mm-hmm.
I mean, I just asked a colleague yesterday for, to be on a grant, and she said, I can't, I'm homeschooling children, right?
Yeah.
So the kind of productivity, I mean, we are, very privileged class, but it becomes very clear, our colleagues who have small children at the moment cannot participate. We know that the publication rates of women are already going down among, in our profession. So I guess, to kind of drive this towards something else. What do you think justice-driven interventions regarding COVID-19 pandemic look like, or what lessons, what should we be doing? What lessons can we take from this? I mean, is there something, I mean, I don't want to talk about a silver lining. I'm not going that far, but, we are also, I mean, part of our job is to make sense of what's going on, is to think about what can we learn, what can we do with this? I'm also thinking about, as researchers, what's our job at this moment? What's the, I mean, in some ways it's a dual question, right? What do we take away? What do we do? What's our job in this moment? I mean, and I know this is, speculative.
Right. Yeah, no, I mean, I've been thinking about this, right? And I'll say, like, I had received some invitations to speak about this or be interviewed about it early on. And at the beginning, I was just kind of like, I don't know that anyone wants to hear what I have to say. Like, I don't know what to take from this yet, because I think, it's been pretty relentless in a lot of ways. But I think first and foremost, so I think thinking about justice-driven interventions, I think first and foremost, we actually need to push ourselves out of this trap of falsely dichotomizing between the economy, like, do we open or reopen? Like, those are the only, or do we stay closed or do we reopen? As though, like, it's like open, closed are the only options. It's like, yes, the economy has slowed down, but it's not like it's totally stopped. And in fact, in reality, it's probably the case that, like, I often think we actually should be thinking about or approaching the economy right now in the way that we would during a war effort, because you're seeing large scale reorientation of industries towards producing other goods, right? Like there is a kind of, we're all in this, we need to, whether it's like the creation of PPE, and I know in Quebec, they've built the factory to do that there.
Distillery making hand sanitizer. This is
right. Like I actually think that makes more sense, because it's not as though there aren't jobs to be had, right? Like, we're going to need contact tracers. We're going to need people working in healthcare. I mean, I'm not saying like any of these are lowest jobs, but there are jobs that need to be done. They're just in different kind of areas, and we need to grant that they might be kind of temporary fields in some way. But also I think we need to get away from that dichotomy in a sense, because we need to recognize, like, that kind of dichotomy is in itself is an artifact of this kind of history of white supremacy and this logic that I think emerges out of slavery, where lives are positioned as valuable or as having worth and being worth continuing only in terms of their relation to capital or capital, production. So I think that, I think we need to, like, move out of that a little bit, especially when we realize that there are countries that have done things to kind of buffer the economic damage, right? Like, this is a kind of unprecedented event. It's also a temporary one. We need to, like, figure out how to get people through it. And, so whether it is countries that have, like, placed holds on mortgage payments or rent payments, or, I think, like we've seen in Canada, I think the unemployment kind of scheme that has happened there has been good, though it only went to show, or I think highlight, some of the other problems that were going on within the system, right? So, CERB has been great. The CERB benefit plan is giving unemployed Canadians $2,000 a month. But then when we compare it to the Ontario Disability Support Program, where disabled folks are only getting like $1,200 a month, and they probably have more needs, right? We know disabled folks have more needs. It's highlighting those kinds of things for us. I think if we're thinking about justice-driven interventions, I mean, I think in the US, like, to be honest, I think the first thing we need to do is nationalize the healthcare system. Like, it needed to be done yesterday, but like, just do it, right? In part because I think we don't recognize the kind of ways that disincentivizes things that we don't want right now, right? Like, people aren't going to go to the doctor just because they're afraid of the bill. And, you know, I think we need to really actually think about getting people out of prisons, detention centers, jails, right? Places that we know are going to be where folks are at high risk of infection. And I think we just need to be being more strategic about putting money into programs that actually help vulnerable populations, right? So whether it's programs that allow give victims of domestic violence like a place to stay, like put them up in a hotel right now, or it is increasing hazard pay for people who are working on the front lines, or those essential workers, like, why aren't they getting health insurance, right? Like, why aren't they getting benefits? But I think in terms of like lessons, I think and I'll only say two things here so we can kind of move on to the Q&A, because I'm very interested to hear what folks have to say.
Yes. So maybe, Caro, maybe to encourage the audience to start putting questions into the Q&A so that we have a few minutes at the end. So you're invited, and Caro has generously agreed to entertain some questions. So if you want to get started on that. But of course, we want to hear, what do you think, social justice? I think that's where you.
Well, so I think, and I think in terms of lessons, I just want to say a couple of brief things. I think first, like, this has been an excellent example or kind of learning opportunity for us to recognize the amount of ableism that we have normalized within the world and within working culture, right? It turns out a lot of jobs can be done flexibly at home. And that's something that those are arguments that have kept disabled folks out of jobs for decades. But in fact, we were able to make very large adjustments very quickly when necessary. I think another thing that I hope we take away, or a big lesson I hope we take away from this is, and I will say, one of the things that really kind of bugs me is I've seen a lot of articles that are saying that, okay, so COVID-19 has revealed all of the cracks in our system, or has revealed the moral failings of you know, our nation state or whatever. These are not cracks. These are not bugs. These are features. It was set up like this, right? Like, it isn't surprising, and it shouldn't be surprising, that the people who are the most vulnerable are the people who are marginalized, right? They are folks who are in nursing homes. They are folks who are essential workers. There are folks who are people of color. And so I think we need to stop thinking that, like, what we have is a good system and we just need to patch the cracks. The system is set up this way. And I think finally, you know, I hope we learn or take away from this, like, we cannot police our way out of this. You know, I think that the kind of police brutality that we are seeing right now is, I don't want to try to say it's new, because it's not, right? Police brutality against people of color have been there for a long time and has been happening for a long time. It's just something that we're now seeing. We're now getting videotape of it. But I think that there is a concern or a move or a kind of push towards increased police powers right now during a crisis, what is ultimately a public health crisis. And really what we should be doing is providing more resources to public health care workers. Like, we need to be treating it as a public health crisis. It's not a police crisis. And anytime you increase police powers, what you see are Black and brown people getting killed. And so I think that is another thing we need to kind of just do.
Right. Okay. Thank you. So we have some questions pouring, and I'm going to probably have to take my glasses off because middle age is not good for eyes. So I think the first question comes from, what do you know, if you feel like you can comment on the relationship between what we might call elite masculinity, you know, for our dear political leaders, like Trump, Johnson, Kenney, and street masculinity, which is the kind of more angry white men who are protesting, who you have just been talking about. So, you know, it seems, I mean, these are entirely different relations to both masculine. Are there entirely different relationships to masculinity, to capital? I mean, how do you make sense of, I mean, masculinity is also this, you know, kind of, I mean, intersectional, there's an intersectional approach to masculinity. So how do you think about those differences? Yeah.
Yeah, for sure. And thanks for that question. I think that's great. And I definitely have been thinking about that as well. And so I think, so I would say I have 2 points on this, and I'm not, this is all very speculative. I'm not 100% sure what I think about it all yet. But so in terms of thinking about kind of elite masculinity, there's something really fascinating to me about the way that elite masculinity is, I think, still being like, it is kind of performatively still about control. And it almost seems about like, this is my plan, I'm pressing ahead with it. I have no, like, there's an unwaveringness to it. I will not take on and adjust my beliefs or positions in relation to new evidence, right? I think there's something there, like there's an epistemological piece, or like an epistemological refusal, that I think is really interesting about that piece. And I think you see that in the way that, like, discussions about how differently gendered politicians have dealt with it really seems to be about, like, we get into debates about, like, who's paying attention to the science, which I think is quite fascinating. And that, there is something, and I will say, like, it's hard for me in some ways to still wrap my head around all of this, because I still think there's part of, like, the American political landscape that I'm still not, I get that I don't understand. Right. Because it's about the kind of connection between these two kinds of groups that I can't quite fully suss out. Insofar as the kind of, you know, the kind of street masculinity that we're seeing, there's a way in which I don't fully understand how they're buying into the elite masculinity. Like, I actually think it's like white supremacy that is making this happen, because I don't know that I think they should be like natural bedfellows in a way. Right. And I think it's white supremacy there, because I think for many folks who are kind of protesting on the streets, who are kind of engaging in this performativeness of street masculinity, in a way, they're making a claim about capital that, like, also, like, doesn't really apply to them, right? Like, they're not capitalists, they're workers. But I actually do think, like, so much of whiteness is about the possibility for class mobility still, right? Like, flagging that correctly. And that's the way that you kind of make sense of how, well, like, I'll be there one day. But I do think there's something about the relationship between the two that still I can't quite work out, because I don't know that I think they should work together. Right.
So maybe there's a research project for somebody.
Yeah.
There's a so there's some really interesting, wonderful questions pouring in right now. So I'm going to fish a little bit. One of the first ones came from our colleague Karen Ball, who said she joined a little bit late, but she was wondering if you could comment on the concept or phenomenon of weathering, to talk about factors related to systemic racism that introduce poor health among people of color, rendering them more vulnerable to COVID-19 complications.
Yeah, no, happy to do so. And so the concept of weathering is related to this phenomenon known as allostatic load. And allostasis is a process that we can compare to homeostasis. So homeostasis is like maintaining maintaining kind of the organism's functions during calm, regular periods of time, right? So when you're not high stress, whereas allostasis is the way in which your body kind of handles periods of crisis, right? So when you're in that kind of fight or flight mode, and the issue is that allostasis is something that, you know, is in theory supposed to be a system that functions in short periods of time, right? Like in theory, we shouldn't be under very, very high stress periods for very long or extended periods of time. Like, you know, it kind of evolves in order to deal with the immediate dangers, right? But what we're actually seeing, and particularly in Black populations, is the effects of long-term stress over time, right? And so this is known as weathering, the kind of effects on various bodily systems that you see that are associated with high allostatic load. And I think allostasis is something that I suspect is kind of more familiar to us all now. So you might have seen there were some good articles that went around a couple of weeks ago about how, you know, all of us who are now in quarantine, we're experiencing a lot of anxiety or difficulty sleeping, or a lot of brain fog. And in part that is probably because we're all experiencing like high allostatic load from the stress of this. And prior to COVID-19, there have been some really great studies that show that weathering is likely correlated with a lot of the increased rates of chronic conditions that you see among Black and other racialized populations. So whether that's hypertension or diabetes, or for example, in Black women, you see very high rates of maternal mortality or infant mortality or preterm birth, even when you correlate for education and class status. And that's a really big indicator, right? Because in the United States, where healthcare access is determined in a lot of ways by class status, what you generally see is an increase in healthcare outcomes as you see an increase in class. Right. But you don't see that in Black populations. And this is often referred to as the paradox of the Black middle class. Is that, or the health paradox, is that their health outcomes actually go down as their class status goes up. And a lot of folks suspect that it's because they experience higher levels of racism and oppression, right? Like the old saying is, the higher you go, the whiter it gets, right? And you're more likely to be isolated. You're probably also more likely to experience this kind of precarious middle class status, right? Like you might still be supporting other folks. And so for many, what we're seeing is very high rates of mortality among Black populations related to COVID-19 that actually can't be explained by underlying indicators. So let's just see. Sorry, I have a very quick note about this, so I want to make sure I get the numbers right. So like for obesity, so for example, there's a lot of, something that's received a lot of media attention is the idea that obesity is something that is correlated with poor outcomes with COVID-19. And so that is being used in part to explain why you're seeing disproportionately high rates of mortality among Black populations. Because we do know that Black folks are somewhere between 3.6 to 2.4 times as likely to die as white folks of COVID-19. Right. And in some places, like if you're in Michigan, Kansas, Wisconsin, or Washington, that ratio goes up to 5 to 7 times. But if you actually look at obesity, right, and the presumption is, okay, well, Black populations are more obese, so this explains it. But if you actually do the comparison, 42.2% of white Americans are obese versus 49.6%. So that's a 7% difference in terms of obesity rates. But what we see is a somewhere to between 240% to 700% difference in terms of mortality rates. Like that correlation doesn't make sense. And it is likely about things like weathering, which we know actually also biologically ages people of color faster in terms of shortening their telomeres. So weathering is probably playing a huge role.
Thank you. And there's another question or comment from Rebecca Sock-Beeson, who says, first, thank you for your brilliance on these very critical and timely matters. And I agree with that. And then points out that the Navajo Nation has surpassed New York and New Jersey for the highest per capita rate of COVID-19 cases. 30 to 40% of people on reservations do not have adequate drinking water. What are your thoughts on this and how to mobilize more awareness on this? And in some ways, I want to pair that a little bit with another question, which is the question that somebody else is asking is, so how can we actually use privileges, our privileges, and I'm talking about people who look like me, to kind of mobilize, to create awareness of what Rebecca mentions, but also to kind of mobilize privilege in order to, to find more social justice responses to this that take questions of racism, anti-Black racism, colonial violence, anti-Indigenous violence into consideration. Just small questions, Kato.
Small questions.
To end on this.
Yeah.
Any thoughts that you might have?
Yeah. First, I want to say thank you to Rebecca for highlighting that. I did really want to highlight or emphasize what's going on with Indigenous populations, and it was in my notes here, but they're a little bit of a mess. So it was my oversight to not make that explicit. But and so I really appreciate you raising that, because it is something that we're seeing. Per capita, Navajo Nation has seen higher mortality and higher morbidity rates than any other place, right? Like if we're in the US, if we're actually thinking about per capita rates. And we're seeing the issues that Indigenous populations in the US are experiencing are the same ones in Canada, right? Like, I don't think if you're upset that Flint hasn't had fresh water or clean water for this long, so do most reservations, right? Like, and I think in part, to me, I actually think, again, it's important to be clear that these are not bugs, these are features, right? Like, this system was built that way. If there were white communities that had not had access to clean water for years, right? Like, it just wouldn't happen. It would be unthinkable. And so in some ways, I think it's actually important that we not think about this as patches, like, or as, well, the issue is we just need to get clean water to them, or like we need to temporarily get better access to healthcare there. Like, I was thrilled when I saw Doctors Without Borders was going to Navajo Nation, but that's a temporary move, right? Like, they're not staying there. And many of the kind of issues that I talked about in relation to weathering and allostatic load, and just, right, like these outcomes are the effect of generations of systematic discrimination and disenfranchisement, right? So I think in terms of highlighting those things, I mean, what do we do about it? How do we mobilize more awareness of it? I mean, I do think we need to highlight right now, because there are so many people, so many different groups and voices who are kind of talking about how they are being disenfranchised in this moment. I think we need to very actively highlight some of those voices over others, in part because their demands are more urgent, they're more basic, right? Like clean water. Clean water is a right. Like, why are we not more angry about this? And so I do think it is about, in some ways, being strategic about the kind of work or the stuff that you do, the people that you highlight. I think in terms of thinking about your privilege, I mean, I think folks need to be contacting their representatives, contacting their police department, like making their anger known, and beyond Facebook.
Yeah.
right? Like you have to go and find the people you can call and call them and send emails and sign petitions. And I think also if you're a person with a good deal of privilege, I think that it is upon you right now to call other people with privilege in. So don't leave it to people of color to have to do the work of explaining to others why they should care. If you have folks in your community who are also other privileged folks like yourselves who are not doing stuff, or who are only reposting the thing on Facebook, right, like ask them what they're practically doing that they could do more of. I also think finding community groups or organizations that you can help support, like the Sylvia Rivera Law Project, like if you're worried about how do you support the victims of police violence, like I think you should think about it as like, how do I deal with the kind of structural issue? Like, how do I deal with trying to combat these institutions and engage with them? But then how do you also help the people, right? And there are freedom funds, there are a lot of folks who are being arrested. I mean, I do think we're going to see more and more riots, unfortunately. And so what can we do to practically help those folks?
Okay, I think that's a good note to end on. I want to thank you, and I'm doing the kind of clapping for all of us because we are, this is not a medium that lends itself for clapping. Thank you so much for joining us today. I also want to thank our audience for asking questions. There's clearly much more that we can talk about. I want to invite you to come back. We are going to do on June 24th, we are doing another IG in conversation with Dr. Salami Bukola, from the Department of Faculty of Nursing. We're going to talk about frontline worker and racism in the COVID-19 crisis. And then in July, we're going to do a session with Dr. Lise Gotell on COVID-19 and gender-based violence. So I invite you all to come back. Thank you for joining us, but thank you specifically, of course, for Dr. Clune-Taylor for offering your very insightful intersectional brilliance to us today. Thank you so much.
Thank you.